Hello guys, welcome to my YouTube channel. I go by the name Dr. Achievement. If you're joining for the first time, please subscribe to my YouTube channel. Today I want to talk about monkeypox disease. Alright, it has been spreading a lot recently, and many people are very scared about monkeypox disease. So I want to break down all you should know about monkeypox disease, how to prevent from getting monkeypox, and the management, the symptoms you can see from monkeypox disease. Alright. And one thing guys, after watching, at the end of watching, please share the video to your friends and family so that they will be able to prevent themselves from getting monkeypox. And don't worry, monkeypox is not same as COVID-19. It's not the new pandemic. I know it is affecting a lot of people, but it's a bit manageable compared to COVID-19. Alright, let's just get down into it. Monkeypox is a rare disease similar to smallpox. Smallpox, we know about smallpox in the 90s, which affected and killed a lot of people. But monkeypox is similar to smallpox. According to them, it says caused by monkeypox virus. Alright, it is mostly found in areas in Africa. Goodness, every time Africa, but has been seen in areas of the world. It causes flu-like symptoms such as fever and cheese. Fever, we know fever, cheese, and a rash that can take weeks to clear. Alright, there is no proven treatment for monkeypox, but it usually goes away on its own, so you don't have to worry, and it's not a life sentence if you're having monkeypox, but we just want you not to spread it around. Right, so at the end of the video I'll tell you what to do and guidelines you should follow. Right, so that's by the way. Let's go to the symptoms of monkeypox. We're having fever, number one. And guys, whenever you're having fever, okay, I'll discuss this at the end. Alright, let's just go straight. Fever, cheese, headache, muscles ache, fatigue, swollen lymph nodes. Alright, all these are indication you're having monkeypox. And if you notice, this indication is similar to the indication of COVID-19. It is similar to indication of other issues, other illness, other virus. Alright, these are a kind of term we call differential diagnosis. Alright, guys, whenever you're having all these points, all these indicators, like let's say you had a very rough day and you just came back and your body is feeling somehow uncomfortable, I will recommend you take some anti-inflammatory pills or NSAID or something like paracetamol, the most common, just to keep you, because it means your immune is fighting. All right, let's just go down and discuss about monkeypox, then I'll come back to that story. Okay, how do you catch monkeypox? Monkeypox is spread when you come in contact with animal or person who is infected with the virus. Alright, animal to person transmission occurs through broken skin. When the skin is broken, like bite or scratch, or through direct contact with an infected animal. Alright, or blood transfusion. We know this transfusion method. Alright, so monkeypox can spread from person to person, but it's less common person to person spread transmission. Occurs, it's less common person to person spread occurs when you are in contact with the sore, scabs, respiratory droplets. We are talking about vomiting, right, or oral fluid, of an infected person, usually in a close contact or intimate situation. We are talking intimate, we mean like sexual contact. Alright, how is monkeypox diagnosed? Guys, before you conclude, if you're having those symptoms where I told you, fever especially, before you conclude you're having any other issues or you indicate you're having monkeypox, please, I'll advise you, it's best to meet a medical professional who will diagnose, who will take your blood samples or anything to get a proper test done. Because without a proper test being done, you might be treating something that does not exist in your body. Alright, so don't get panicked, just go to the hospital and get a proper test done. So there are different diagnostic method which we can go. Alright, to diagnose monkeypox, your healthcare provider will take a tissue sample, like open lesion. They can take your blood sample and they can diagnose to check if there is a monkeypox virus in your body. Alright, is monkeypox curable? Monkeypox usually is a self-limited disease with symptoms lasting from 2 to 4 weeks. All right, so you don't have to worry, and panic is not a death sentence. Its symptoms will last, and sometimes it will just leave your body. All right, if you're just following the appropriate medical procedures, just avoid spreading it to your family members. Try to isolate yourself, and don't worry, it will clear off. All right, and remember, guys, you should keep on boosting your immunity. Coming back to that story, when you have any symptoms of fever, do not forget that fever means a sign that your immunity is being invaded. All right, that is the major sign. It's just like we're having the police in the country, and once there's a terrorist attack, you will be hearing in that area, you'll be hearing a lot of sirens, a lot of news article, a lot of contacts, something like that. That is sign in our body too. Fever will just tell you there's something happening. Your immunes are fighting. The police surrounding your environment, your internal environment, are into war. You should do something. You should help them. What will the government do if there is a terrorist attack in his country? He will be sending the military. He will be buying more weapons. He will be helping to solve the issues, right? That is what you should do. That is why I recommend most people, what I do basically, and that has been a tradition in my family. Whenever we have fever and we feel somehow bad, we just take paracetamol, just only paracetamol, PCM. Take one, know the amount of dosage that your body can require. Like me, I go for 500 mg, just one tablet. All right, depending on your country, depending on your nationality, your tribe, you should know the kind of dosage, and your age, you should know the kind of dosage you can be able to sustain and work effectively. You just take one PCM and don't worry about it, because it's as if you're boosting more immunity to the system. It will help the issues. That it works for me. I don't know how 100% sure is this concept, but for me it works. That is what I'm just trying to say. So until now, there's no medical cure for the monkeypox, but you can prevent the monkeypox. And don't worry, if you're just boosting your immunity can fight against the monkeypox virus, and it will leave your body for, according to the article, 2 to 4 weeks. Right? Let's talk about how do you prevent monkeypox virus. Okay, a small vaccine provided protection against monkeypox. All right, a vaccine has been made, all right, to protect against monkeypox. And just 1 minute. Vaccine has made to prevent against monkeypox, and avoid contact with infected person, avoid contact with bleeding and other materials contaminated with the virus. We can't basically know who is the infected person. It does not show in the face. We can't know who, except the post, that this person has been confirmed that the person is infected. Apart from that, we can't know, and we can't know the materials which is contaminated. All right, and they say wash your hand. That is my other last point. And they say wear masks, clean and disinfect frequently, and use personal protective equipment when caring for people infected with the virus. All right. So my point is, guys, whenever you see sick people, if you come to the hospital where I used to I work, all right, what we do after seeing any sick person, we don't care whether tuberculosis, whether not tuberculosis, whether head pain, whether leg pain. Before we see them, we sanitize our hands, put on gloves, sanitize the gloves, then we touch them. After working on them, we sanitize the gloves again, dispose the gloves, then sanitize our hands. Then at the end of the day, we wash our hands. Then we go back to the hospital and to our own department. Then we sanitize our hands again. We take and before we go to those ICU's departments, we often put on some face masks. All right, we'll put on some face masks to cover and prevent us from getting infected. All right, and prevent us from circulating the infection to the other person. So you should always be protective of this medical ways in preventing you getting contacted. And at the end of going out in the day, you go to your workplace or you go to anywhere. After you just reach the place, try to wash your hands with soap and water. You don't know what you touch on your way going anywhere you're going. And after coming back home from work, wash your hands with soap and water before you touch anything in your houses and before you do anything in your houses. Even I know people wash their hands before they eat, but I recommend once you just step foot to your house, wash your hands with soap and water. Then at the end of the day, if you want to eat, still wash your hands with soap and water. You can help prevent this virus. All right. And guys, please don't forget, whenever you feel a bit ill, just take the paracetamol. Don't worry, you're just boosting your immune. Don't take too much. No, ask your doctor or your medical professional the recommended amount of mgs you should take per day. All right, you take it and don't worry, your immunity will be boosted. You'll be fine. The monkeypox will affect and do whatever it wants to do, but it won't invade your immunity. It's just as if you're giving the immunity cells a machine guns to fight against the traitors in your body. Right. Thank you for watching. This is just a little bit explanation of monkeypox, and I don't want anybody to panic much about this disease. All right, because it is controllable. Bye. Have a very nice day.